A joint team of WHO and Chinese experts has completed a week-long mission in several areas of China, including the outbreak epicenter, Wuhan. The WHO team says China's efforts have averted at least 10,000 or even tens of thousands of possible infected cases. Earlier, I talked to Dr. Gauden Galea, the WHO representative to China. He has been trying to help me to understand how WHO sees the issue of the accuracy of numbers behind China's cases and fatality statistics. And while the world is gearing up efforts to contain the spread of COVID-19, so far there's still no known cure for the disease. So how can we uncover the cure? He also shed some light on all of these issues. Let's listen in.
The raw data comes from China, but beyond that, there are a large number of studies that are conducted, both by WHO as well as by independent scientists. For example, most of the modeling work, or a lot of the modeling work, has been done even outside China. The patterns of what is being seen and reported in China can now be validated with outbreaks and clusters in many other countries. So once you start to see the behavior of the epidemic, the trends in the numbers being consistent, then that continues to add to the confidence.
Dr. Galea, any of the policies that you mentioned earlier has a lot to do with the accuracy of the statistics. The people who are confirmed, the recovered, the mortality rate, and many other things. So how trustworthy are the numbers?
In any epidemic, you're fighting the virus, you're fighting the pathogen, you're caring for patients, you're identifying cases, you're bringing people in, you're testing, you're reporting, you're collating, you're analyzing. You cannot rely on just one number. You need to look at the number of cases reported. You need to look at them by date of onset. You need to look at tests among people who have influenza-like illnesses or severe acute respiratory illness. You need to visit the clinics and see the numbers of people being processed. And it is impossible to fake all these sources of data and make them all say the same thing. Beyond that, there would be an exercise in modeling to see, so if this is happening, then what do I expect here or there? And then set up sensitivity analyses where you give a range of what is the expected reality. And if you start to find that all of that is consistent, then you understand that you have a good measure of accuracy. And finally, anecdotally, being on the ground, talking to the people involved in the care, talking to the people involved in the investigation, one starts to get an increasing confidence that the numbers are as close to the reality as one can get. In the graphs that have been published, you see a big rise in the number for February the 1st. Yeah. And it's difficult to explain what happened on that date. It appears that there was a coding issue in the sense that people who were asked, at least this is the most rational explanation, that on that date people were asked when was the onset of your symptoms, and they said early February, and they were coded as the 1st of February, and you get an increased number of cases there. So you do get, and this is part of the reality of working with an epidemic of this nature.
There is a debate now, Dr. Galea, about the fatality rate. People around the world are afraid that the outbreak would go to their country too. What do you make of the current debate about whether fatality rate is approximately what it is being reported in the numbers, or actually there are a lot of missing points as some could be suspected of?
The practical question is it's impossible to know the accurate case fatality rate until the whole picture is ended. The pattern of mortality generally is is much smaller than at the beginning, but it is not a negligible number. The general pattern that we are seeing in China was, at the beginning, there was a very high rate because most of the early cases were the most severe, the easiest to detect. And there was a very high rate of mortality among them. As it was understood that the disease has a broader spectrum and more, and the case definition evolved to consider a broader range of presentations of the disease, the base population grew larger and the numbers of deaths proportionately smaller. Later in the epidemic, as the cases are getting more and more resolved and either in the main recovering, that's the most cases, and the small minority unfortunately die and succumb to the serious forms of the disease, that number is now increasing in number of deaths.
The Spanish flu, which is the biggest epidemic we have seen, 2 to 3%, if I remember right. People are already suggesting, experts particularly, that this could be very severe. Your take?
In China, we see two patterns. One in Wuhan, where there's community transmission, there's a huge burden on the health system. There is a higher risk of dying than in the rest of the country, where the risk is very small. So with populations that are well prepared, with good health systems that are ready to detect and provide immediate supportive therapy, where there's a very quick identification of cases and a very quick initiation of support and case management, the mortality has been kept quite low. It is still, though, causing severe illness in 15 to 20% of the cases, and that is not to be disregarded. So it is a formidable condition and one that requires to be taken with attention.
Dr. Gauden Galea, the WHO representative, in our conversation, the exclusive interview, he also touched on several important questions still unanswered related to the virus. However, he did indicate, as long as the genome sequence of the virus is clear, we can at least do a lot to prevent and control COVID-19. What about the fact that we still do not know much about the virus? No patient zero discovered, no already tested remedies and vaccines. We do not know 100% the host of the virus and the immediate host of the virus, and meanwhile some of the early evidence were already not existing. So what does this say to us, Dr. Galea, about how much really do we know about this?
We are in a situation where we do know now what are the essential tools needed to stop it, even in the absence of a vaccine and of therapy. It's also recognized that there are questions. What is the ultimate source? It's very important to continue to investigate that, because the last thing one wants is to have this epidemic end and then for it to be started again. That is untenable. So that research is very important. We are still without a vaccine and treatment. The research on that, it must be a huge priority, because it is entirely possible that this disease could become like an influenza that could persist in the human population.
I noted you say like influenza, but certainly not influenza.
It is not SARS, it is not influenza. It's a virus, it's its own disease. So I said that in order to suggest that there is the possibility that it could become endemic. It could become a virus in our environment that humans have to live with over time. And that, if that happens, then you do want to have these active tools of vaccination for prevention of cases and of treatment for any person who gets infected and needs that treatment. The time to do much of that research is now, while there are a lot of cases around, and to be able to allocate cases to the trials that are needed to ensure that there are the therapies both for the present but also for future encounters with this virus. So all that you say about the source, about vaccination and treatment is part of the global research framework that has been pulled together with the participation of Chinese experts at a global meeting held recently in Geneva. So there is a blueprint for research that is the imperative that we need to go forward.
What about the earlier cases of COVID-19? In November, there were already reports that many cases already existed, but some were even suspicious of earlier than that. So, Dr. Galea, how will resolving the myth of this help us to understand the real nature of this virus and the origin of the virus? Do you think WHO is urging important sides to do work as much as possible on this front as well? Because this is the ultimate question that needs to be answered, as you already indicated.
Certainly, it is extremely important to trace back as far as possible in the history of the epidemic. And the Huanan seafood market, in a way, presented for China as much as for WHO an indicator that there had been a spillover from the animal world into the human world, that somewhere it had happened. As I have, I think, even said in our last conversation, all of these cases were happening at a time of increasing influenza-like illness. And the multiple episodes of people with respiratory symptoms, even serious conditions, would have been masking what was clearly low numbers. There were not the large numbers that we are seeing now. So how far back does it go? It's very important to be looking at past imaging studies done in hospitals to trace back lineages of relationship and transmission between cases and deaths. That investigation needs to be completed, as well as the animal-human interface. We need this in order to be able to reassure ourselves that there is not a cause of continuing transmission, but that does not diminish the force of what I have said earlier, that all the current cases are especially outside Wuhan and Hubei, are cases where we have household information about household clusters, and it's very much of a different pattern than there was in the early stages. So we need to continue that research, high priority, but at the same time continue our work on case definition, contact tracing, and the management of both.
Yeah, last question about whether it is lab-produced virus. I see there is a debate in the society. However, experts have been speaking out around the world. Your take?
There's a bat involved. So at some point, the genes are similar, very similar to a species, to that of a coronavirus found in a species of bat. The important thing is to identify which animal is the cause and where is the lineage. It does not. One hears about multiple debates. They need to resolve themselves in a scientific fashion, we have to continue the epidemiologic investigation.
Dr. Gauden Galea, the WHO representative to China. That's all we have for today. If you'd like to see more, try to find us World Insight CGTN. You can search us online. You can also find us through YouTube channel and also Twitter and Facebook accounts. I'm Tian Wei. On behalf of my team, thanks for watching and bye for now.